Welcome to the Healthspark, Igniting Healthcare Management Change and Evolution. I'm your host, Dr. Gingeraya. Hi, I'm Dr. Gingeraya with the Healthspark, Igniting Healthcare Management and Change. And today I have our guests from Syracuse University. They just recently won the 16th annual virtual case competition with the George Millen Fleming Center. So I'd like to welcome the Syracuse University team. Welcome, everybody.
Thank you.
So I'm going to give a very abbreviated introduction into this extensive team's impressive background, and then I'll let them elaborate a little bit about themselves. So first up, I have Zhenxi. Zhenxi, did I say that correctly?
Yes,
Okay.
that's correct.
Great.
Thank you.
Thanks for waving. That's a great idea. Please wave as I introduce you. She's an MBA candidate from Syracuse University. She's specializing in finance and supply chain, originally trained in tea science. Is that correct?
Yes, that's correct.
Okay. She now focuses on data-driven strategy in healthcare innovation. She's also certified as a tea artist and avid outdoor enthusiast. Welcome, Zen. Next up is Alexandra Perry.
Hi.
She's a dual MBA MS biotechnology student, blending clinical experience, lab research, and business strategy. A former medical assistant, is that correct?
Yes, that's correct.
Research presenter. She aims to become a biotech patent attorney. She speaks 3 languages, loves snowboarding and creative hobbies. Welcome, Alexandra.
Thank you so much for having me.
Yes, thank you. Next up is Allison Hellman.
Hi.
Hi, Allison. Allison is an MBA MS in biotechnology student. She's focused on life science consulting and commercialization. A former biology teacher and cancer lab researcher, she's a 2-time case competition winner with her work soon to be published. She's a runner, a knitter, and a climber. Welcome, Allison.
Thank you.
Next up is Xiaoying Feng. She's a marketing PhD candidate, studying how consumers respond to emerging technologies like AI. With roots in biomedical engineering, her work spans advertising, EMS research, and behavioral insight. She also leads the National AMA programming and is an avid dancer. Welcome, Xiaoying.
Hi, thank you.
Thank you. And last but not least is Celso Perez Mayo. He is a master's of business analytics student with an expertise in optimization, modeling, and data-driven supply chain strategy. He's consulted for solar energy firms, taught analytics, and volunteers extensively. His goal is to work in humanitarian logistics after graduation. Welcome, Celso.
Thanks for having me.
Thank you. So I don't know if you all want to talk a little bit about yourselves, tell us when you're graduating, tell us what your plans are before we jump into the questions.
Absolutely, sure. So I'll start. Like Dr. Raya said, I am a dual master's student studying biotech and then also doing my MBA. And I really focus on market analysis and commercialization. So essentially studying how new technologies work on the biotech side, and then explaining them to clients and really making sure that these ideas that founders come up with are grounded in reality. So making sure that when people have these great ideas, that they actually can sell, and also that the people they're selling them to understand what the product is. Because I used to be a high school teacher, I'm really comfortable explaining complex concepts in biology and speaking to different types of audiences. And so I feel like that experience really just kind of set me up to enter the world of business.
Excellent. And when are you graduating?
I'm graduating in December of 2026.
Wow. Okay. Soon.
Next year, but yeah.
Yeah. Okay, great. All right. Who's next?
I can go ahead and go next.
Great.
Hi, I'm Alex, and I am originally from Leesburg, Virginia. and I'm graduating in May of 2027. And I plan to go and pursue my JD right after. I have background as being a medical assistant, like you had said prior. I've worked with podiatrists, I've worked with neurosurgeons, I've been a medical scribe. I've really just been in the medical field for a very long time, and through that, I found my passion for patent litigation. Which is a very abrupt turn from medical to patent law. Especially, I worked with research on stem cells, so working further again with patent law. Really, it's just there for me. So yes,
Awesome. When are you graduating?
graduating in May 2027.
Okay, great. Thank you. All right.
I can go next. Hello again, I'm Jen. As you just mentioned, I'm an MBA student and concentrating in finance and supply chain. And my goal is to become a consumer analytics. If I'm lucky enough, I want to be in the healthcare industry. So right now, I have a background, as you just mentioned, in the agriculture science, and I'm a specialist in tea science. And actually, I work a couple of years with rural farmers. So I kind of know how the rural communities have like limited resources, have labor shortage, some kind of problem. And my job is to introduce some advanced technologies for them to increase their efficiency and productivity. Um, Overall, I kind of explore like how much the rural system really depends on the smart, practical, and accessible solution. So that's my eager and some motivation for me to join this competition.
Excellent. Thank you. And when do you graduate?
Oh, I graduated in 2026 May, so it's pretty soon.
Yeah, soon. Okay, welcome.
Thank you.
So, hi everyone, my name is Xiaoying and I'm a PhD candidate in marketing science school. And I actually have a background in biomedical engineering before. So my first internship actually was in the hospital, but the first day when I was in the hospital, a patient suddenly passed away and the family have a meltdown outside my office. So my heart is really like broken down. So it kind of pushed me away. I would like say, okay, I'm gonna stay away from the healthcare because it seems scary. But somehow, I think I still have some interconnection with my folks here. So right now we're solving some healthcare related issue, and so my research right now is mainly about technology adoptions, and I want to see how people kind of like adopt the technology and how adopting technology can shape the beliefs of themselves. And in the between, I like to volunteer a lot. So in the past times, I volunteer in the NAACP, and then I also volunteer in the Syracuse Orchestra. There's a bunch of different organizations, so I have the experience to working with different people. And I love walking a lot. One time I walked from Central Park on top of the New York City Museum all the way down to Wall Street, and then I walked like 6 hours. It was really cool experience.
And where are you in your PhD journey?
So
Will you be
I'm
done?
at my very final stage. So currently I'm also teaching undergrad course as an independent instructor. Hopefully I can get it finished in 1 year, one more year.
Great. Good for you. Congratulations.
Thank
All
you.
right, so.
Hi again, my name's Celso. I'm originally from Tabasco, Mexico, but I have been here a while, as you can tell. But when I'm not in school, I live in Houston, Texas, so actually pretty close to where the cases takes place. And right now I'm doing my master's in business analytics, but I actually just finished my undergrad in supply chain management with a minor in philosophy, interestingly enough. I'm also a TA in supply chain courses, like you mentioned. So I've gotten a chance to do a lot of logistics and supply chain analytics through that, using different programs. Yeah, I'm excited to be here.
All right, well, welcome. So one of my first new sub questions after the questions I gave you all was, how did you all meet? And the reason I wanted to know that question is because your team is very inner collaborative and very dynamic. And I did feel like that was probably very complementary and probably one of the reasons why you all did so well, because you all are very balanced and very, very different. So how did you all meet?
So we kind of all met through a variety of different ways. Jen and I actually interned together at the Innovation Law Center at Syracuse. So we worked with different early stage startup clients on their technologies, looking at the patents they had developed and then seeing if they were able to then successfully sell that technology, build and sell that technology. And then similarly in the biotech program, Alexandra and I collaborated in a lab class that we took together. So we got to kind of work together in the lab and see that both of us were interested in not just doing bench science, but also bringing it to market too. And then I'll let Alex and Jen talk about how they brought in Xiaoying and Celso too.
Yeah, because me and Xiaoying are from China, so that's kind of like a collaboration way for us to be together. And she's one of the most like kindest PhD in our department. So I was like, okay, I really want to be friendly with you, and I know you're doing some amazing marketing job. Maybe you want to join us as like teammates in the competition.
Great, great, great.
So actually, Jen, she's a vice president of the event of Women Women in Business.
Yes.
And I was the former long, long time ago when I did my master in the same school. I was in that program. So they host different event, professional event for the women. And then one of the event they held was the, I think, some health awareness. And then they
Yes.
just not target to like a female who need to take care of themselves. Also, they wanted to like kind of advocate their partner as a male. Also, like take some extra time to take care of both of themselves and also their partner. So that's how we got connected through those events.
Yeah.
Okay.
So actually, recently we just held like a yoga event, and I invited all of our teammates to join us.
That was really fun.
Awesome.
Yeah, Celso and I have known each other for what, 4 or 5 years now. We've known each other since freshman year undergrad. So it's been a very long time. And I brought him in here because I knew that he was doing a business. Well, he was originally doing business analytics masters, and then he changed to
No, other way around. So
other way around, a supply chain management. Now he's doing business analytics. Sorry. And I knew that he was doing that, so I really wanted him to come and join us in this case competition. And actually, Allison was the one who recruited me to do this case competition. We met, as she said earlier, through a tissue culture lab. I think we actually became friends because she killed our cells.
No.
So I think it's a lot of fun to work with people that do good work. They're very reliable people, and I'm very grateful to have been a part of this team and been invited on this case competition.
Okay, cool. All right, so let's get into it. So I want to talk about the case a little bit for context so that people understand why I'm asking you the questions that I'm asking you. So I wrote the case because I felt like there's some interesting things happening in rural healthcare. And although I wrote the case to be about the rural situation in the state of Texas, it's not exclusive to what's happening in the state of Texas. It's happening everywhere in the US. And so the way the case was written, one of the problems that everyone is experiencing in rural healthcare is that hospitals are becoming insolvent, right? They're not able to manage. They are frequently, having knee-jerk reactions and setting up, clinics and CT imaging, and then discontinuing things like delivery room service lines because, that population is leaving to urban communities and shutting down skilled nursing facilities. But we know that things like data, having improvements in data, in analytics and technology, things like dashboards could improve the way rural healthcare entities react to the environment, but they don't have those resources. So the case was written to create the opportunity for a consulting team to come in with the state, with the support of the state and create this digital performance improvement plan that you all had the leeway to, use publicly available data. You weren't given, it's a 2-page case. You were given no resources, right? Go out and find publicly available data. So you all were tasked with using things like the census, HRSA data. What else was in there? I don't know what, you guys can tell us what else you use, but really any publicly available data, community needs assessments. And you were given the choice of 3 rural markets to focus on to create this digital improvement plan to help make rural hospitals more solvent. And so there were a total of 13 teams that were competing across the nation, and you all were the clear winners in the case. So what I want to know is, what role did you all play in breaking down this case? You only had 3 weeks to do this. You all are all physically in New York. How did you all tackle this case? What role did you play? And then what strengths or perspectives do you feel like you had in trying to come up with the solution A and B, to win this case in 3 weeks?
So I think we'll first kind of outline each of our roles, and then we'll kind of dive into how we tackled the problem. So for me, because I'd done that work with market analysis at my internship, I took the role of financial lead, kind of making sure that when we came up with the costs associated with our solution, that they were realistic. A lot of times in case competitions, teams come up with great ideas, but they don't ground them in data. And so the client then can't use it. They feel like, I could never afford this. This is not an idea I'd actually use. So I made sure everything was really based in like Medicaid data from the state health services. And the other thing is, I helped draft our governance solution just because I've worked with a lot of administrators being in the public school system. And so I could kind of get into the mind of my old bosses and think, would they actually use this? Would they actually work together? And that was kind of the approach that I took.
Okay.
I was more so the rural market lead. So basically choosing and determining which actually county or region that we were going to pick for our digital implementation tool. And so my whole thing was understanding rural healthcare dynamics and analyzing each Texas region that you had given us, which was 3 of them. And we did land upon Southeast Coastal Corridor, which was the, yeah. It basically, I was determining where our solution would have had the strongest impact and highest chance of long-term success, since the whole point was to have a pilot program. And I would say that the biggest strength that I brought to the team was my clinical background. As I said prior, I was a medical assistant, medical scribe. I've worked with podiatrists, neurosurgeons. So I've seen firsthand how there's like resource limitations, over reliance on emergency departments, and system gaps that affect real people in today. So I think that perspective that I brought really helped ground our analysis in what rural patients and providers actually experience today, and not just looking at theoretical models, actually having that real life experience.
Okay.
So my role is to develop the core tool, which we have a name, which is WHIM. And we first define we need to be like an ecosystem, not just like one tool. So we have 4 core part of our ecosystem. The one is the WHIM Insight, the one is the WHIM Engage, and the third one is the EHR. The fourth one is the telehealth. So my main job is to develop the WHIM Insights, but also design the logic about like how this 4 part could connect with each other. Yeah.
Okay.
And for my role, so when we first read this case, it's really, really short case. And then I asked Allison, okay, is all the case competition are like that? Like not much information available, and then how we gonna start? And then when we see the digital this word, and then I was like, so telehealth. But if it's the solution is telehealth that's simple, then like you wouldn't like build this into a case competition, a national case competition for bring out all the team to come up with the solution. So our team think that we must come up with something more sexier than or more workable other than telehealth. So I come in, and then as John say that about the WHIM to have forecourt, and then I was in charge of one part of it, which is the patient engagement too. So for marketing, a lot of people will think that, okay, you guys definitely work on a lot of work related to engagement, because if you look at social media, so a huge part of about the algorithm is to get people engaged. And then not just that, like a basic concept in terms of in marketing is also the distribution of like how the technology, how the technology is diffused, and then how people kind of adopt. And then there are lots of barriers for people like not adopt. And I has a big experience in terms of analyzing the EMS data. It was a huge data set, and a lot of kind of patient record there is like not compliance. But I see patient also a type of customer. It's not just so simple as like not complying. There are a reason for them. I believe that they already make the best decision they could make based on the limited time, limiting constraint, everything. So I was in charge of that part to see what can be work for our system.
Excellent.
For my part, I leveraged more of my logistics background and made sure that our solution that we implemented made sense. So I focused more on like choosing a provider, making sure the telehealth system actually worked in these regions. We also looked at regulatory compliance, specifically like HIPAA, stuff like that, which was pretty complicated. I had to talk to my team about that a couple times, but through it. And then lastly, I'm taking more courses on data and data security. So I use that for making sure that our tool, our RIM tool, was secure.
Excellent. Excellent. Great job. Okay, so you may have answered the second question of, well, maybe not. Well, I mean, I still want to know more. So how did your team begin tackling this very complex problem of rural health sustainability? And what early decisions shaped your strategy? I mean, you all talk about your roles, but this was still, and I thank you so much for talking me through your logic, because you're right, it is only 2 pages. And I appreciate you all, questioning personally my sanity and was this normal? But how did you begin to unravel this?
So I mean, you're saying like the problems in rural health hospital sustainability, but there really just isn't one problem that we've realized. It's like a web of problems that all interact with each other, and one on top of one. It's kind of like an avalanche. It goes smaller, and then it gets bigger and bigger and bigger, and then it kind of implodes at the bottom, right? So you're seeing like financial problems, workforce shortages, infrastructure problems, as well as commercial challenges that all kind of interact with each other, like I had said prior. And I think before jumping into solutions, our team as a whole agreed to kind of zoom out and build a shared understanding of the problem from like multiple different angles, because we didn't want to base our market selection off of rural stereotypes. We wanted to kind of look at it as an individual and really analyze what we were doing in each market, because it allowed us to build WHIM from the ground up, and to kind of help with meet the needs of the Southeast Coastal Corridor after determining the rural market selection. For example, we see Matagorda County in the Southeast Coastal Corridor. They're struggling with a lot of metabolic disease, teen pregnancy, and that tool could help with these kinds of particular conditions. So we had to realize that the innovation would be digital. So then we had to look at the broadband, which you did provide in the case. You did say kind of more the broadband maps. So we did take into account, and for the Southeast Coastal Corridor, we saw that that was the best kind of chance that the pilot would have, in comparison to the two other regions that you had provided with for us. And so once we kind of knew which county to look at, we had a basic idea of like what our tool would do, and then we divvied up the work based on our strengths. So we had people work in like marketing and the digital tool, financials, the incentives as well as the digital implementation strategy. And then there was also my role, which was to understand the rural dynamics and selecting the right region. So that structure kind of helped us break down this huge problem into these more manageable action pieces.
Excellent.
So like Alex was saying, once we had picked the market, we really needed to pick a specific problem to solve from the financial angle. And the big discovery we found when we looked at the tax filings of these hospitals and really looked at the healthcare data is that increasing revenue, just trying to drive more people to the hospital, wasn't going to work, because the big problem that they were facing that was causing all of these other cyclical problems to compound is uncompensated care. So basically, people coming into the hospital who don't have the ability to pay, and then the hospital has to just eat that cost and cover it for them. So we realized that we couldn't come up with some kind of like flavor of the month solution that would just drive revenue, or we couldn't just cut costs, kind of like hospitals are often doing, just cutting services. It had to be something that was based in preventative care and kind of met patients where they were at. But the good news for us is, again, like Alex says, a lot of the issues that patients in Matagorda and Wharton County were facing are preventable issues. So issues related to metabolic conditions, things related to stress, or people that are just using the emergency room as primary care. So we realized that WHIM needed to really kind of hit those issues and solve the uncompensated care burden, rather than just trying to drive more people toward the hospital.
Okay. All right. So let's talk about your tool. So what part of this request for a digital performance improvement plan, or your WHIM, did you feel were the most innovative? And how did they support the needs of your market or your rural hospitals in your chosen market area?
Okay, I would take this question. So, as I just said, we have like a four core parts of our ecosystem, and there is a two parts I think is most innovative. The first one is the WHIM Insight, which is our in-hospital risk scoring and triage engine, and the second part is the WHIM Engage, which is Xiaoying's part, is like the self-engagement insensitive. So I will talk some about the WHIM Insights, like how it works and how I kind of build it. Actually, our starting point is pretty simple. We kind of want to understand what information the clinic can already have. Like Alice and Alex just mentioned, we have the EHR, and we have it's somehow capable for the telehealth. So we said, okay, we can start with this part. And also we figure out some gaps we remain, which is the limited staff and the long waiting time. So we were like, okay, maybe we can solve this problem. And then we kind of ask ourselves, can we make the experience more faster, more safer, or more consistent? That's our starting point. And from there, we map up our whole patient journey. We build our patient whose name is Maria. We mentioned in our presentation, and we start with she goes into check-in and how our system could get her quickly go to the ER room or to the telehealth room. And then we kind of think, okay, how she can get support at home. And we want to make it like a closed loop journey. And this is how we start to build our solution. And understand where the digital tool could really reduce some bottlenecks. And my contribution is to build the WHIM Insight, which I just mentioned is a triage engine. It basically can classify the patients in 4 different levels during the check-in process. So it's kind of related to the unnecessary ER visit, which we kind of want to reduce that, and the limited clinic and the long waiting time. We kind of fix that. And to make it more reliable, we use the CHNA report priority factors to create 18 questions across 6 domains. And each questions, we put it in a numerical score. And when patients scan the QR code and they can finish the question in 3 to 4 minutes, and end of that, they will give a cumulative score. And this score can shows up in a clinical portal, which the nurse can see it. And also the nurse can see the patient's EHR and also the telehealth doctor availability. So club all of this information, the nurse can quickly decide like whether to put the patients into the emergency room or put in our virtual telehealth room. This is, and like our goal is to avoid unnecessary waiting time and also giving comfort to the patients. It's like we are taking care of you. We're not just ignore you, just let you wait there. So overall, the WHIM insight is to translate the traditional, the slow trace system into a really like fast and structured engine. So that's kind of related to the southeast coastal corridor, that type of problem.
And tell me again, what does WHIM stand for?
Wellness and health insight model. And then there's 2 parts, WHIM insight, which Alina talked about, and then WHIM engage, which Xiaoying is going to talk about.
Okay, great.
And I love the Maria story, and then I feel like my teammate is super smart, like bring up that story, and that actually helped us to come up with another part of that solution, which is we are thinking about, okay, right now Maria is like out of the hospital. So what other things we can do for her outside the hospital? Because, you know, like majority of the healthcare actually happen in home or maybe when they are on their own. So that's the another part of this system. And personally, I think innovation not necessarily is something new, or maybe it's not necessarily something that you say, wow. So I think innovation has to like work. Like sometimes some innovation can be wow in a place, but it can be a failure in another place because you really need to make it work. So my job is to make it worse in this especially rural hospital. As Alison say, she is the financial person, and then I think at one point when we were coming up with the solution, and then I was like, okay, Alison, how much you can give it to me for solve this problem, and what is the maximum I can get, and what's the least I can get. So within this like more realistic range, and then we come up with this solution. And also when it comes to incentive program, people always ask, you just gonna give free stuff for people, is it gonna work, and then what if people cheat, etc. So our team really want to deliver something that is built on some already proven evidence. So we start to like look for research, and then luckily we find something, it works, especially in Texas, which is a WHIM study, and it was very carefully designed a 3-year clinical trial related to the incentive program, and it proved that the patient activation was the mechanism it worked. So we kind of hold on that mechanism. But however, for that program, it costs $1,800 per year for a patient. And then Alison was saying, oh my gosh, Xiaoying, you need to come up with something that $1,800, we're not able to do it. So that's how we like step by step. And then we think, okay, since right now it's like the study was done back in 2015 to 2018. So right now it's like 2025, and then it's another digital era, and then people are more familiar and more comfortable with some digital tool. So that's how we are able to change something. So the first thing is like in the study, they use some personal coach to reach out to you, to interview you. It's not necessarily just saying that, okay, you need to lose weight right now, but instead they helping them to build their personal goal, and then to listen to them to see what they really need, and then what's the ideal or healthy solution, what's the ideal version of a healthy you. And so we took that part in, and then we kind of like use some like we have the virtual consultant there to kind of like it's a more cost-effective solution, but still, even though it's a digital tool and a digital platform, we still have the personal touch. And because it was done in virtually, so that way we can save some costs, but still kind of like help them to have their personal growth and then understand their needs. And then the second thing is like I believe that the knowledge is like very powerful, and then it can be fundamental to motivate someone to do something to have change. So that's why there are two parts in the inside, no, not in the inside, but in the engagement too. The first part is we want to create some content, because right now I think a lot of people are consuming a lot of like TikTok style or YouTube style, but those information can be very fragmented, and maybe it's not even tailored to specific someone who facing some problem in Texas. So I think this can be a very scalable and also can be very good quality kind of delivery for the patient in that area if we have some content specific, more tailored to them, and then they can also learn from them. And then another part of the innovation will be we kind of put them into a point system. So it's kind of similar to a loyalty program in airline, but you earn the points through like studying, or maybe you can join a group, and then every day you just like together make some delicious meal and then share, and then you can earn the points. And then we are successfully able to allocate some budget to it, so people can earn the point and then get something. And then I think the very good part of this is like this model can be very flexible. And then what I mean is like I'm a more data-driven type of like marketing training, and then we understand what optimization works. And then as long as we get more data, actually we can get a very good sweet point about like, because we are saying that we have a point earning program. So if we have more resource, then we can get the earning point a little bit lower, so everyone can get more points and then get to like some a goodie or something, healthy food or whatever like we can provide to them. But when the resource is very limited, then we can kind of like put the ratio a little bit lower, but it depends on the real data. So this is the flexible part of it. And then on the other hand, engagement, this type of thing, we can also optimize, but not in the sense that optimize for our like ROI or whatever investment, but more like with the limited resource, we can reach out to more people, and then we can bring out the benefit to more people. So I think that's the good part of the innovation.
Awesome. Awesome. Okay. Anything else before I move on?
No, I think that's that's pretty much our tool and how it works.
Excellent. Excellent. Okay. So
All right.
let's get back to question 4. So now that you're done with all your research, what is the biggest threat? What are you most concerned about in regards to the biggest threat facing rural hospitals today?
So we had a couple threats, but I think the biggest one, or the first one, is the essentially financial threat causing knee-jerk responses like you talked about earlier. So when hospitals look at their income statements at the end of the year and they see, oh my gosh, we're losing money, we're at a loss, and there's news articles, this big news cycle, the hospital's going to close, they start to just cut services and kind of pursue this like very reactive set of decisions that becomes just a band-aid solution. And then the community loses care, they lose services they need. So things like labor and delivery, if someone has a baby, that service is really necessary and it's something that can get cut. We saw that was really a problem in Texas over the last 20 years. They've seen 70% of hospitals actually have cut back on services. And so with a number that high, that's a really big problem. And so as we were developing our tool and doing research in the case, we really wanted to make sure that we weren't just creating a solution that would work for 5 years while we had the grant money and then it would die as soon as the money left, but really something sustainable. So really something that would lead to immediate savings and break even fairly quickly, but then also would lead to lasting change that would help the hospital kind of shift into a more proactive mode of thinking rather than just going and kind of cutting.
I think a second huge problem that hospitals are also seeing is workforce shortages. I feel like a broken record. Yeah, every time I speak, I talk about it, but it is such a huge problem and it is so prominent, and it is one of the biggest factors as to why hospitals are also losing money. I mean, we're seeing huge clinician burnout, huge nurse burnout, any kind of healthcare worker. They're getting overworked, underpaid, and quite frankly, yeah. And we're seeing them burn out, they're quitting, or they're taking a step back. And then we're seeing hospitals having to rely on these very expensive contracts. I mean, you're paying for travel nurses, contract nurses, anything like that. And they're just losing so much money. I think there was about $22 million in loss for hospitals annually, just from workforce shortages.
It is so concerning, and I'm so glad that you all picked up on that and that you saw the prevalence of that. So thank you so much for echoing that. Were you all going to say anything else, Celso?
Yeah. Going off of that, we also, our solution involves telehealth, and so we're using that to kind of bridge our workforce shortages. But at least personally, like I met a lot of people in these areas. What if they can't take to our implementation methods? Like, it's new technology. Sure, we had COVID meetings, stuff like that, but sometimes people are adverse to meeting online with a doctor, and that's something like we took into consideration, especially looking at the FCC broadband map, like we generously provided. Some areas, while it is increasing in broadband availability, some areas might not have that. Some don't have high-speed internet, and we have to really think about like, what are we doing to make sure that this program works? We have the nurses, we have telehealth providers, but who's being left out? Like, what if people, maybe they don't speak English as well? And so for our providers, like, we made sure like Spanish language and accessibility is a thing. We also made sure that like, if the video call is inaccessible, like text messaging and SMS and just phone call works. Our engaged who also like incentivizes like digital literacy. We want to make sure people know how to use devices, troubleshoot them. The biggest takeaway we have from that is making sure that our solution included the in-person telehealth rooms to start off with. And correct me if I'm wrong, anyone, but the way to work is our patient would go in and be request an emergency room, and we'd say, okay, we can meet with the doctor. We're short-staffed for X reasons. We have a telehealth room available if you want to go in there. A nurse will help talk to the process, make sure you're set up, and the care will be right away. So that way they're incentivized to use that process first. The nurse is there, they're at the hospital, there's not going to be any connection issues. And now we can get more people acclimated to the system, make sure they trust it before they go back home and talk about it to their friends, and just improve the longevity of our solution.
Excellent. Excellent. Okay. I love that I feel like you guys thought through so much, and how well-rounded your thought process was, your solution was, and clearly it really was. And I feel like you all answered all of the judges' concerns in the case, and that you all presented such a great solution. So, okay, let me get to the last question. If we were to implement your plan today, what impact do you think it could have on rural healthcare over the next 5 years? Or how has this experience shaped your aspiration? Well, let me ask you that question later. So if we implemented your plan today, what do you think the impact of this could be first?
So, like we kind of mentioned when discussing the threats, we think if WHIM were implemented, it would really help hospitals get out of survival mode, and particularly from the standpoint of the executives, it would allow them to really understand how they could work together, rather than seeing each other as competitors. When the finances are really tight, it's very tempting to compete for patients, but the advisory board and task force structure we developed with the executive director could kind of help them see avenues to work together. And then once that collaboration's in place on the patient side, the patients could really have a role and have more agency in their own healthcare. So overall, it would be kind of a more sustainable and proactive approach that we think could really transform rural healthcare from all angles. So the executives, the patients, and then also the clinicians as well. Yeah.
Okay. And then I have a last question. I mean, how has this experience changed or altered your perspective as, being or becoming emerging healthcare leaders?
Yeah, I think the most important thing that the competition reinforced us is the solution should be practical.
Mm,
You need to always think about who you are helping with. that's the key point for the whole competition. So as we mentioned that at first of this of the like the podcast, we all have our career goal. I want to be the consumer analytics, and I know Allison want to be a life science consulting, and also want to work in the logistic and the nonprofit sector, and Xiaoying want to be a marketing professor. I know Alex want to be a patent attorney. So all of this job need a lot of face-to-face communication. So we are not only need to be confident about our solution, our technology, our product, we also need to focus on how our solution could address the clients, the consumers' real life problem.
Okay,
The key thing that way we think about this competition.
excellent. And I think really that's how you all also won, because it was it made sense, it was practical. You all checked all the boxes. Anybody else want to chime in?
And for me, I don't consider myself gonna be an emerging healthcare
Yeah.
leader, but I'm sure because I wanted to be a marketing professor, I believe that every year, maybe one or two in the future may become the healthcare leader. So I would like to encourage them, just use my case to encourage them to maybe jump out of the box. Like, even though you're majoring in marketing, but it can be a like field that intersect with a lot of different things. Just try to, like, this case is really out of my comfort zone, even though like I kind of have a background in bio related thing. It's really difficult, and it's a huge like complex problem, and I'm glad that my teammate dragged me in, and then together we work together to push like out of our comfort zone. And I would encourage my students to do the same thing and try to connect with people from different fields, and then try to like think cooperated together to fix some problems.
Right. No matter what, we're all patients, right? And healthcare matters to all of us. We're all born in healthcare, and we all might die in healthcare. So it's important to all of us. So thank you so much again for the work that you did, the impact that this could potentially have on other people, your insight. We're so grateful for your participation. I thought again this was excellent. So thank you again, Zen, Alexandra, Allison, Showing, and Celso for your participation and for participating in the Healthspark.
Thank
Thank
you
you
so much.
Thank you. We'll talk to y'all soon.
Yeah, see you
Thank
later.
you.
Thank you.
For having us.
Thanks for listening to the Healthspark, igniting healthcare management change and evolution. Please look out for future episodes and follow us on our social media pages.